Welcome everyone to this webinar on PAD, peripheral artery disease. We will start this webinar with a general presentation of this guide with Dr. Jean-Pascal Costa, and then we'll move to PAD medication and surgery. To do so, we will have a presentation of PAD medication and surgery by Dr. Xavier Omery-Boucher.
So hi everyone, very happy to be with you today for this webinar on peripheral artery disease that we also called PAD. My name is Jean-Pascal Costa. I'm an internal medicine specialist working at the CHUM Hospital in Montreal, and my role today is to present to you our wonderful guide. After this short presentation, I will let my colleague, Dr. Xavier Omery-Boucher, talk to you a bit more about the treatment of PAD. So I'll start by giving you some information on the guide, and then Dr. Omery-Boucher will go on with the treatments of PAD, and we'll have a short period of questions at the end. So before we go on, let me explain the reasons behind this guide. So first of all, we started with the following observation. PAD is an unknown disease by general population. If we compare to other diseases like heart attack, stroke, or breast cancer, PAD is not as advertised. We then identified the need to create information intended for patients and family, as well as for healthcare professionals that take care of these patients. We then consulted an instructional designer to help us with the content and the way to present that content. We also hired a graphic designer who created wonderful illustrations to highlight the content. The next step was to determine the table of content, and then we had to find some authors, specialists in their own fields. We then gave them a challenge. The challenge was for them to use plain language and write a text accessible for all. And I have to say that they were able to rise to the challenge. So here you can see the different themes tackled in the guide. So first of all, we start by giving a definition of the peripheral artery disease. And then we go on by explaining what's happening in your legs. We then give some risk factors related to PAD. And then we explain the diagnostic methods. There's also a chapter on how peripheral artery disease affects your daily life. And there's another chapter on the treatments. And we finish by giving some tools to help the patients and their family to deal with the disease. So here you can see the different authors of the guide. So people coming from different disciplines. For example, we have residents in general internal medicine. We have residents in radiology. We have psychologists. We also have vascular surgeons and residents in vascular surgery. And we also have kinesiotherapists. So the guide is a total of 20 collaborators, people from editors to reviewers. I have to acknowledge donations from Bayer, Canada, and from generous families and Canadian institutions that really help to financing this project. I have to thank Mr. Gabriel Dumochel, our instructional designer, and Christine Saint-Onge, our graphic designer. Speaking of Christine Saint-Onge, here you can admire her amazing graphic work. So here you can see examples of pages of the guide. As you can see, once again, amazing illustrations by Christine Saint-Onge. And this brings me to introduce our good friend, Tim. So Tim is our mascot, our friendly character who takes care of his health and who likes it when the information is short and simple. So this means that if you don't have time to read the entire guide, You just need to find Tim, and he will give you a summary of what you need to know on each chapter of the guide. So, allow me to join my good friend Tim, and together we wish you happy reading. Thank you very much.
My name is Xavier Omery-Boucher. I'm a resident in vascular surgery at the University of Montreal. My presentation is going to be about the treatment methods for peripheral artery disease. I have no conflict of interest for this presentation. I wanted to mention that there are additional videos available on the Foundation's platforms, including the YouTube channel and the website. The other videos are about the global presentation of PAD, the diagnostic, and the physical activity. So if those subjects are of interest to you, I suggest that you go and watch the videos and learn more about these subjects. So I wanted to start the presentation by talking about the natural course of the disease. What I mean by natural course is the progression of the disease without any form of treatment. So there are various studies that looked at the 5-year follow-up for patients presenting with PAD. In these studies, we saw that there is between 50 to 75% of the patients that at the 5-year follow-up had a stable or improving condition. So the majority of the patients remained the same or even improved their symptoms. 25% of the patients showed progression of the symptoms. So progression means that they could have smaller a smaller walking distance without pain, or maybe they developed rest pain or ulcers underfoot. 5 to 25% of the patients required therapeutic intervention, and 2 to 4% of the patients required major amputation because there wasn't enough blood flow in the leg or the foot. I also wanted to show the relative importance of the various risk factors. So in the graphic on the right side, you can see the risk factors listed and the relative importance of the risk factor. So for example, you can see that for the smoking or the diabetes, the increase in the risk of developing PAD is 3 to 4 times higher than the risk for people without those risk factors. You can also see that there are non-modifiable risk factors, such as being a man or being older, but there are modifiable risk factors that we can work on, such as diabetes and hypertension, which can be treated with lifestyle modification or with medication. And there is also a smoking that is a strong risk factor that is modifiable. So the first half of my presentation is going to be about the medical treatments. That includes lifestyle modification, like I said, with the diet or the physical activity. And it also includes medication. So this first slide is about smoking cessation. So for those who have already tried smoking, they know that it can be very hard and it can take multiple attempts before successfully stopping smoking. This table is a table about the tools that the patients can use to stop smoking. And on the right column, we can see the abstinence rate. So that is the percentage of the patients that have used one tool that have successfully stopped smoking. So the most efficient tool that the patients can use is the nicotine patch combined with the nicotine gum or spray. So the nicotine patch helps maintain a certain level of nicotine, and it can be tapered down and eventually wean off the nicotine. But the patch doesn't help to control the craving for smoking that the patients can have. So that is where the gum or the spray is helpful. It's to control those craving. So we can see on the right column that 36.5% of the patients that have used the patch combined with the gum or spray have stopped smoking. We can compare it to the varenicline, which is also known under the name Champix. So it's a medication that patients also can use to stop smoking, and it's about the same abstinence rate with 33.2%. The diabetes and hypertensions are also two big risk factors in the development of PAD. I won't go into details with those two risk factors because the treatment of these comorbidities can be complex, and it can take multiple medications to have a good control. But I will mention the targets that we aim for. So for diabetes, we aim for a glycated hemoglobin under 7%. So the glycated hemoglobin is a blood test that your doctor can order. It's a reflect of the past few months of the blood glucose on average for the past few months. So for those who take their finger glucose, it's an average of 8.6 or less. It's an average, so sometimes it can be higher, but we still aim for lower than 8.6 on average. The hypertension target for those who take their blood pressure at home or at the pharmacy, we aim for a systolic pressure under 140, which is the higher number, and a diastolic pressure under 90, which is the lower number. So if you take your glucose level or your blood pressure at home and you're worried because the values that you have are not within the target, I suggest that you talk about it with your doctor to control better the blood pressure and the glucose. After that, the control of dyslipidemia, which is the cholesterol in the blood, is also an important risk factors. The first line of treatment for dyslipidemia is a lifestyle modification. So eating better with the diet and doing physical activity helps control the dyslipidemia. It also helps control the diabetes and the hypertension. In combination with those modifications, we use the statins, which is a medication that helps improves lipid balance by decreasing the bad cholesterol and increasing the good cholesterol in the blood. It also stabilizes and even reduces the PAD. And some studies also showed that the patient taking statins had an increase in the walking distance without pain. So it improved their symptoms. Another medication that we use in PAD is the antiplatelet therapy and anticoagulation. The molecules that are the most used are aspirin and clopidogrel, which is also known under the name Plavix. These are mainly used to prevent cardiovascular events such as myocardial infarction or heart attack, and also to prevent strokes and the global cardiovascular mortality. Recent studies have also shown that there may be a value in using small doses of rivaroxaban, an anticoagulant, to prevent global cardiovascular risk. The patients that were selected in these studies were patients with a higher risk profile, for example, with heart disease, or patients that had already had a surgery or an intervention for revascularization and had a recurrence of symptoms. The last slide for medical treatment is about physical activity. There is another video that is available on this subject, but I wanted to include a little bit of physical activity in my presentation because it is the best modality of treatment for PAD. So the mechanisms by which the physical activity helps improve the symptoms is first by the formation of collateral vessels. So that is what you see on the picture on the screen. In the picture A, you can see a normal vessel without any disease in it. In the picture B, there is a narrowing of the artery, so we can see small branches of the vessel that are connecting themselves to form a bypass. So the blood can flow through those small collateral vessels and bypass the narrowing. And on the picture C, there is a full occlusion of the vessel, and the collaterals are even bigger, so the blood can flow through those collaterals and bypass the occlusion. There is also a cellular adaptation to the lack of oxygen. So the muscular cells are getting used to live without as much oxygen as before the narrowing or the stenosis. So the symptoms get better after a while. And the physical activity also helps control risk factors. Like I said, it also controls dyslipidemia, hypertension, and diabetes. So by controlling the risk factors, it improves the symptoms and it prevents progression of the disease. The suggested exercise is walking. It is the most efficient to improve the symptoms of PAD. It is suggested to do physical activity 3 to 5 times a week. It's easier to start with 35 minutes and then increase up to 50 minutes per every time you do physical activity. And the best advice with physical activity for PAD is to not be afraid of the pain. So what is suggested is that the patient walks until the pain is too high and the patient can't continue walking. So at this moment, it is suggested to stop, take a rest, and then start walking again until the pain arises, and do cycles like that, to walk until the pain starts, stop, take a rest, and then repeat for the whole 35 or 50 minutes of physical activity. So that the second half of the presentation is going to be about surgical treatment. There are three main approaches that can be used for treatment of PAD. The first one is endovascular approach. So the endovascular approach is a less invasive technique where the artery is punctured with a needle and the access is gained to the arterial system, and with small guide wires and catheters can treat the disease in the artery with balloon angioplasty and stenting. So there's going to be another slide about that where I'm going to show you some pictures. There is also the open approach, which is the more classic approach with open surgery. So that is where we do incisions and we go through the vessels to treat it. There is also the hybrid approach. It's a combination of those two techniques where we expose the vessel, treat the vessel, and then use this access to treat the disease elsewhere in the arterial system with the endovascular approach. The decisions to use one approach or another one is based on multiple factors. One of them is the location of the disease. So the disease in some arteries is easily accessed by open approach, and in other arteries, it is easier with the endovascular approach. There is also the presence of venous conduit. So that means that for the open approach, we usually do endarterectomy or bypasses. And the bypasses are a conduit between an LT artery and an artery lower in the arterial system, for example, lower in the leg. And the bypass is used to bypass an occlusion or a narrowing of the artery. And in vascular surgery, we often use veins to do the bypass or synthetic material. So if a vein is available for the surgery, we might want an open approach. And if there is no conduit, no vein available, it might point towards an endovascular approach. Also, the age and the comorbidities of the patient is taken into account because the endovascular approach is less invasive and there is less risk than the open approach. So the two main techniques used in the endovascular approach are the balloon angioplasty and arterial stenting. So the picture that you see on the screen, in the upper part, we can see a narrowing of the artery with the plaque, with the disease. And there is a catheter that is inside the artery. On the lower part of the picture, when the balloon is inflated, the plaque is it's opening the artery. And to maintain the artery patent, to maintain it open, we can use a stent, which is often on the balloon, and it stays in place to keep the artery open. In the open approach, we use mainly two techniques, which are the endarterectomy and the arterial bypass. So the endarterectomy is a technique where we expose the vessel, and like you can see, the vessel is opened, the plaque is taken out, and then after that, after the disease is removed, the artery is closed with often with a patch of synthetic material or a bovine pericardium. And like I already explained, there is the arterial bypass, which is a conduit that is made between a LT artery and the artery after the stenosis or the occlusion. So here on the picture, we can see a prosthetic material that is used to do the bypass and to bring more blood after the narrowing or the occlusion of the artery. So that is all for the overview of the surgical and the medical treatment of PAD. Once again, I suggest that you go and watch the other videos if you want more information about the other subjects that I mentioned. The best advice I can give to someone who is wondering how is peripheral artery disease can be surgically treated is to have a discussion with a vascular surgeon. So the first thing that this patient wants to know is it possible to have a treatment with an open approach or with an endovascular approach? So some disease cannot be treated by either way, and sometimes it can be treated with both ways. So the first thing is to know if it is possible. Then what this patient wants to know is what are the risks of the procedures. So usually the open procedure has more risk, more cardiovascular risk or pulmonary risk than the endovascular approach. So this has to be evaluated, and the vascular surgeon can provide helpful information about the risks. What the patient also wants to know is what is the patency rate of the interventions. So that means is the artery going to stay open for long or not? So some procedures have a high patency rate, so they stay open and they stay the artery that is treated or the bypass stays healthy for a lot of years, and so sometimes it's a less patent procedure, and the artery can narrow or occlude again after the procedure. So with all this information, the patient can take a good decision based on the patency rate, the risks that are related to the procedures, and the possibility of doing one or another procedure. So if I start with the endovascular procedures, these can be done in the angiography department with radiologists specialized in the interventional technique. It can also be done in the operating room by a vascular surgeon. So usually these procedures are not done under general anesthesia. They can be done under regional or local anesthesia. So the surgeon can do a puncture directly in the groin where the endovascular procedure usually takes place, and inject a local anesthetic. An anesthetist can also do a puncture in the back and inject the medication that is used to do the anesthesia. So these procedures, because of the analgesic that is used, are usually not painful. The only part that can be a little bit painful is when we inflate the balloon, like I said earlier, with the balloon angioplasty. It can be hurtful for the patient, but the pain usually starts only when we inflate the balloon and goes away instantly when we deflate the balloon. It can take, if the procedure is small, it can only take 30 minutes or an hour. If it's a more complicated procedure, it can take a few hours to complete it. For the open surgery, depending on what needs to be done, the procedure takes place in the operating room. It can be done under general, regional, or local anesthesia. And depending on what needs to be done, again, it can take a few hours to complete the surgery. So the advice that I could give to a patient after a procedure that wants to preserve the benefits of the procedure are to start working on the risk factors that can be improved. So, for example, after a patient had a procedure, I would suggest that he starts walking and moving as soon as possible, because like we saw earlier in the presentation, the physical activity helps prevent the progression of the disease. So it helps prevent another narrowing or occlusion of the artery or the bypass that he just had. Smoking cessation is also a big part of the treatment because we know that patients who have bypasses and still smoke after the intervention are more at risk that the bypass occludes and that the disease progress in the arteries. Uh, Modifications of lifestyle also includes diet, so eating better, and also taking the medication that was prescribed after the intervention. So usually what is prescribed is an antiplatelet like aspirin and the statin that I presented earlier in the presentation. So modifications of the risk factors, uh, taking the aspirin and the statin, and the physical activity is the main components of the treatment to preserve a bypass or to preserve a stent that was just installed in the arteries.